So spinal cord stimulation has been around for over 40 years. It's a tool that is used to help people with chronic pain. And as you can imagine, in the last 10 years with the advancements in technology, spinal cord stimulation has advanced exponentially. This system here that I'm demonstrating today is the Boston Scientific Spectra spinal cord stimulator platform. And what I do is I mimic what the doctor does, which the doctor implants 2 lead wires, we call them leads, into the epidural space of the spine. And then I tell the software what level and where on the spine we place them. And then the software puts together a stimulation algorithm that will hopefully target the painful areas of the patient with the feedback from the patient and really be able to disrupt those pain signals at the core, which is the spinal cord. So we disrupt those signals, and rather than pain reaching the brain, the pain signals, a smooth tingling vibration sensation is perceived. It's called paresthesia. And in turn, the patient's usually able to be more active, cut back on their pain meds, and obviously have a reduction in pain. And so that's the overview of how the system works.
Spinal cord stimulators are for patients who've had post-laminectomy or have had laminectomies, and now they're diagnosed with post-laminectomy syndrome. They're also for patients who have diabetic peripheral neuropathy and patients who have chronic pain, or radicular type pain is what we call it, pain that shoots down the leg or pain that shoots down into the arms. I implant those in both the cervical spine and in the lumbar spine, so neck and low back, for patients who have pain that shoots down the arm or down the legs. What we do is we do an epidural first, and we put lead wires into the back. The patients try that for a week and see if they like it, so they get to kind of kick the tires before they actually have the device placed. Then what we do is bring it back in, and then we do a surgery where we make 2 small incisions. We put wires in the back again. We tunnel those under the skin, and then we put a little generator over the buttock. And then from that point on, patients have control of their pain with the use of electricity. So the stimulators send electricity in the spine. They block pain by really blocking the signals that are coming from either the arm or the leg. And patients get programs, so they can change the programs around as much as they need to. We usually give patients 4 programs, and so if they want a really, really strong stimulus, they can have that. If they want real light stimulus, they can have that. And so it's a really good way for patients to control their own pain. The good thing about those is there's no medication involved, and so patients don't feel sedated. They don't feel all the side effects of taking opiate pain medications. There's no constipation or anything with those, and you get really, really good pain relief.
Yeah, this little remote gave me my life back. It controls the device that was implanted in my back. I can control it. I can set the intensity or the duration. I can control where it's going to take most of the pain away, or take all the pain away, or somebody else can control it. There's programs that you set up, and you can name them, and like I have back 1, back 2, sleeping, my legs. That way, if in the middle of the night, if I need to change it, I can just, kind of push legs or whatever, and it goes, just turns itself on. It recharges. There's a recharger all the time. I've had this for 2 weeks now, and I haven't put it on the charger once. Not once. And it still looks like it has.
So you haven't shut off?
Oh. Yeah. I mean, it's still got 3 bars. That's crazy because it's running 24 hours, 7 days a week, constantly. You can feel them. You can either feel the stimulator, or you can set it to where you don't feel anything. Some people like to be able to feel that something is there and something's doing something. If you can't feel it, how do you know it's helping? You just know you don't have the pain. I like to feel it once in a while because it helps me to remember that I have legs, because I don't have feeling in my legs because of the nerve damage. But that's fine. There's no more pain. My legs still work. They're fine. They will get stronger, but they're not going to be in pain to where I can't walk anymore.